stroke in women than men, and it abolishes the usual protection, cardiovascular protection what we have, and again HIP strongly predicts the future type 2. We have higher rates of obesity and central adipose in many regions including South Asia. And regarding the social disadvantages of women with diabetes, we see they are socially disadvantaged more in South Asian context. And unmarried women face difficulty in marriage and higher dowry demands, and widowed women faces financial burden. And there is a lower female sex ratio in North India. There is preference more for male child. And the women with diabetes, they are viewed as an unwanted burden, and men with illness receive better care and support, and personal beliefs alters the care-seeking behavior, and so there is a need to reform the factors shaping women's diabetes. Thank you, Lily. Thank you. So diabetes disproportionately impacts women's health. She has brought so many important women. Legends. And women with diabetes, they have 2 to 4 times higher risk of cardiovascular problem. They have accelerated atherosclerosis and worse outcomes post-MI. And hormonal fluctuation across menstrual cycle, pregnancy, and menopause significantly complicates the homeostasis and insulin sensitivity. Of course, gestational diabetes affects 1 in 6 births globally and increases the maternal-fetal risk, including preeclampsia, macrosomia, and neonatal hypoglycemia recurring. Intensive monitoring. So here comes the solution. The FemTech revolutionizes the women's health. The emergence of the female-focused digital health technologies represents a paradigm shift in addressing the long-standing gender disproportion in healthcare system and also care research outcomes. This FemTech integrates the artificial intelligence, wearables, biosensors, and personalized medicine to create targeted solutions for women's unique physiological needs across the lifespan. And it addresses other than reproductive health like management, including diabetes, autoimmune disorders, thyroid, and non-communicable common conditions in females. And it has developed a targeted solution for migraine management, risk carcinoma direction, mental health support, and also cardiovascular risk assessment tailored to female physiology. If you take AI, artificial intelligence in women health, it has got a predictive analysis. It anticipated fluctuation in 30 to 60 minutes prior the event happens, and so that we can go for proactive interventions. And also it has a multimodal integration that it includes all this heart rate variability, physical activity, sleep quality, stress markers, and enables personal insulin dosing requirements. And the Scarrett's fertility partnership with Dexcom and Quira provides a comprehensive metabolic insights for conception planning. Again, the digital health innovations, if you take in women with diabetes, is widely applied in chronic disease management, and definitely it has demonstrated a clinical improvement and cost saving, and increases use in type 2 diabetes, prevents the complications later via this text message, web-based system, telemedicine, and mobile health wearables, and artificial intelligence. And evidence has clearly shown that reduces the weight and dysglycemia, and also reduces the incidence of type 2 diabetes, improves A1C and metabolic outcomes. And all these upon computer-based and mobile health shows strong effects. And these telehealth platforms expand access to endocrinologists and certified diabetes educators, particularly benefiting the rural and underserved women. The Sweet Mama app pilots provide culturally tailored support for low-income pregnant women managing gestational diabetes across diverse US communities. And we have so many of this, the leading FemTech companies and startups. If we say the Flow Health, here the reproductive health platform has 300 million users globally with AI-powered cycle prediction and symptom tracking. And this Movan Clinic, this provides virtual care for family building, pregnancy, postpartum, and menopause. And the Kiran Medical gives breast carcinoma detection with a superior accuracy. And again, if you see the improved outcomes in men, it supports the lifestyle modification and wellness and assists the treatment for chronic diseases like diabetes. It has got an exponential growth in digital health use over recent years. There is increasing integration into a routine hospital care delivery, and this enables decision making, improves the quality of healthcare delivery, and also addresses the growing burden of diabetes. Of course, if you see the digital health ecosystem for diabetes in Indian women, the government of India launched the National Digital Health Mission to address the complex health problems. And India is the second largest mobile consumer globally. So the smartphone, I'm not able to see. Can you have something in the bottom? Hello? Can you keep something below? Or I have to lift this? And a high smartphone penetrates the, if it's little above, it will be better. A little above like that. Thank you. So there is a scope across the care continuum like health promotion, disease prevention, primary care and specialized care. And it also, we know that diabetes is a chronic disease requiring continuous follow-up. It helps a lot, and again long-term glycemic monitoring is very much essential, and prevention of future complications. All these are very much possible with this digital health. So enables the tracking for patients, clinicians, and policymakers, and supports the analysis to assess impact and outcomes. But it's not moving. But the problem is the funding landscape and challenges. What we have is the women health setups receive only 2% of the healthcare venture despite serving 50% of the population and addresses critical unmet needs, medical needs. Despite this, 92% of the FemTech startups, female entrepreneurs receive a disproportionately lower funding and face higher scrutiny during investigation due diligence process compared to male counterparts. And our Indian women digitally ready, they did a cross-sectional study across 640 districts, diabetic women in India, and has found that 10.7% of women suffer from this, and prevalence of diabetes is significantly higher in groups with higher digital literacy. So, for example, the urban residents, they have more prevalence compared to the rural, and higher education, and those with have a higher education have more percentage of this prevalence is more, and again where they have a high wealth quantile, the richest have 13.46, whereas only 7 with the poor. And this also digital interventions are done in all the comorbidities, focus on the weight management and BP tracking, which is very important. And there are some geographical hotspots also. We have some priority regions for FemTech. The burden of diabetes is not uniform across India. There are some high burden regions. There is all southern states suggesting for a need for localized digital health solutions like Mizoram, Goa, and there are low burden regions like Rajasthan, Bihar, Meghalaya, Jharkhand, and Arunachal Pradesh. What are the barriers? Even with all this, there are some barriers like technological, where the challenges with app interface or connectivity and behavioral and also healthcare systems and patient-related. So what we need is a clear need for clinician-led education and also support to bridge the knowledge gap and transition to make it sustained usage. And this telemedicine bridges the gap between the urban and rural. In India, we have a very poor physical health care in rural. And it is mainly urban based. This telemedicine serves as a vital equalizer for the rural women who are not at all bothered about their health. And this also overcomes the distance and travel in rural areas. The telemedicine allows women to receive quality care at their doorsteps, eliminating the need for long, expensive journeys to cities and continuity of care. The diabetes management system demonstrates that remote follow-up through phone or email can lead to significant reduction in HbA1c, decreased frequency of hypoglycemias, and personalized titration of insulin and oral health with physical visits. And overall, this becomes cost effective, what the women really wants in the family. These systems are proven to be safe and inexpensive alternative for intensive type 2 diabetes management, preserving the family resources. For example, the Chunambet Rural Diabetes Prevention Project. I am proud that it is from Tamil Nadu, where this project provides underserved rural women through tele-diabetology. The mobile unit is equipped with advanced diagnostics like digital retinal cameras, computerized ECG, Doppler, brings the hospital in the village, and it gives a comprehensive screening. It facilitates mass education and screening for diabetes and also complications like retinopathy, foot problems, nephropathy, and heart diseases in remote areas of South India. And targeted education, this uses the video conferencing to disseminate the awareness about prevention and glycose control directly to the rural women. The other B2O, this has been significantly increasing in female users, and it has grown 20 times in the last 5 years, and it has impacted the life of over 6 lakh women, and majority of the residents are in 2, 3, 4 tiers and beyond that tier cities. And this hybrid closed list system, the NHS England initiated the phased rollout of this HCL technology to pregnant women with type 1 starting in 24, representing major advance in maternal care. The systemized automatic adjustment of bolus insulin delivers every 5 minutes based on current glucose readings and predict algorithms, maintains targets like glycemic ranges. Again, this digital twins and personalized medicine enables sex-specific management, drug discovery, optimized insulin dosing algorithms, prediction of individual treatment responses, and this revolutionizes the clinical trials and chronic disease management approaches in women. And of course, the next generation biometrics like novel hydrogen-based treatments for menopausal symptoms demonstrates promising effect in preclinical studies, offers hormone-free alterations for symptom management, and advise biometric therapies addressing the vaginal dryness and genitourinary syndrome of menopause. And these innovations hold particularly promising for aging women with diabetes who face compounded challenges from hormonal changes and also metabolic dysfunction during menopausal period. And expanding this beyond gender barriers, it includes the design must address the unique healthcare needs of the transgender men who also have experienced menstruation, pregnancy, and other traditional female health conditions. So, how will we empower the women with via digital health? Of course, India has, from the age of 35 to 49, 10.7% diabetes prevalence in women, especially in the urban, educated, and obese cohorts. The digital readiness gap is 51.51% in urban, but it is not used in 63%. There are significant barriers remaining in technology, literacy, and healthcare system integration. The CGM is a catalyst change, both AGP and this reduces the HbA1c and inspires patients to manage their condition through real-time feedback. And all these AI-driven digital twin technologies improves the quality of life and enables personalized data-driven treatment titration. Thank you.